Welcome to the Functional Medicine Foundations podcast, where we explore root cause medicine, engage in conversation with functional and integrative medicine experts, and build community with like-minded health seekers. I'm your host, Amber Warren. Let's dig deeper. Hi, everybody. Welcome back. We're here with Heather Lucas to talk all things female hormones, which is always a very engaging and exciting conversation. So Heather Lucas is a functional medicine nurse practitioner with a deep passion for hormone optimization, sexual wellness, peptides, metabolic health, and longevity. She believes you deserve to feel your best to show up for your family, your career, your friends, and yourself. Outside of work, Heather enjoys skiing, camping, and making cherished memories with her family. I love that bio. So to the point, so straightforward, and so simple. I love it. And so important on what we touch on. Welcome.
Yes, thank you.
Yay.
Thank you for having me.
You're practicing here now at our Eagle facility, Center for Optimal Health.
Yes.
With Functional Medicine of Idaho, and we're so excited to have you. I feel like we've definitely done a handful of topics, I should say podcasts, on this topic of hormonal health when it comes to females. But I feel like we haven't really hit hard what I want to make sure we hit hard tonight, which is optimization, right? Which is really what we're about here at the Center for Optimal Health. So let's just start with talking about as we age, and you and I talk so much about what's going on with our bodies, right? As women in our late 30s and early 40s. So as we age, what kind of shift do we start to see with our hormones?
Great question. So many women come into our clinic in their late 30s, early 40s when they start to see these hormonal changes. Mm-hmm. And maybe they're just a little less tolerant of stress, or they're noticing some mood swings or dry skin or insomnia.
Mm-hmm. Weight gain.
Yeah. Women have three primary sex hormones, progesterone, estrogen, and testosterone. Mm-hmm. And they really start to fluctuate kind of in our mid 30s. And oftentimes after the birth of our second child, We'll notice some big hormonal changes that we just can't seem to bounce back the way we did after the birth of our first child. Right. And so we see these decline in these hormones that lead all the way up through menopause, which in the United States, the average age of menopause is 51. Mm-hmm. And we know what happens at that age is when our ovaries just kind of quit working and producing those feel-good hormones for us. So shifts in these hormones can include a variety of symptoms. I've already spoke of a couple of them, but irregular periods, hot flashes, night sweats, anxiety, depression, mood swings, vaginal dryness, increase in headaches, weight gain, especially around the midsection. That seems to be one that changes in our estrogen levels will change our body composition and how we store excess body fat. Changes in our ability to put on lean muscle as our testosterone declines and we're still lifting weights in the gym. We're just struggling to put on lean muscle or even trying to lose those last 5 vanity pounds or
that
whatever.
Body composition that women are like, this used to be no big deal. And now it's just that lean body mass and fat loss that women start to really struggle with.
Exactly. Yeah. And it's so frustrating.
You feel like you're doing everything right.
They don't work anymore. Yeah. Our old tricks to how we used to be able to shape our bodies. How about decrease in libido?
Yeah.
I mean, a lot of women come in vaginal dryness, decreased libido, just no interest in sex. This is a shift in our hormones that cause some of these things. Less energy and insomnia, waking up at 2 to 3 a.m., not able to go back to sleep, the monkey brain, your mind is spinning. Could be from a decrease in our progesterone, our calming hormone. Postmenopausally, after that age 51 or when you have gone more than 12 months, that's the definition of menopause. You've gone more than 12 months without a regular monthly cycle. We would see these hormone deficiencies even increase further, which leads to increased risk of cardiovascular disease, osteoporosis,
Alzheimer's
dementia. A lot of it related to low levels of estrogen.
Yeah. I think there's a myth that we just like estrogen levels just slowly decline, kind of like men and testosterone, right? And then just really drop after menopause. And sometimes that can be the case, but in more instances, we actually see estrogen swinging big in perimenopause, right?
Yeah.
So it isn't actually necessarily the estrogen deficiency, it's the huge swings in estrogen that we see in perimenopause driving a lot of these symptoms. We think of low libido as mostly like being driven by testosterone, but a lot of it's estrogen swings as well.
Absolutely.
That's causing some of the low libido and weight gain and things like that.
Mm-hmm.
Wonderful. So talk to us, like mention the top, I'm kind of putting you on the spot here, but when we talk about the 3 hormones you just said, what are the 3 things that come to your mind, or the top 2 or 3 things that come to your mind with each hormone, right? So testosterone, we've got like libido and drive motivation. That's what I think of mostly with testosterone as it starts to decline in women. And it's probably worth mentioning testosterone we do see it drop similar to men. You know, we have much lower levels than men do, but still a very potent and important hormone in us. And we do see a slow shift of testosterone, right? That's not one that we see kind of.
It's not a fluctuating one, but just a slow decline as we age. Our ovaries just aren't as efficient at creating optimal levels for us anymore.
Right. Mm-hmm. Yeah. No, that's good. And progesterone, same thing. It's really fluctuating throughout perimenopause.
Yeah.
We see it really dip in what we call the luteal phase.
Yes.
Right.
The time between ovulation and the start of our period, when you might notice things like more insomnia, or you're kind of snapping at your husband or your kids, or you sometimes look at yourself in the mirror and be like, I don't even know who I am right now. It just feels so different. How come I was able to handle this a few years ago, but now I'm not able to handle it the same way. Yeah.
You've actually helped teach me with some of the specialty hormone training you've done, a lot of the more uncommon symptoms we see in women that can still be, I shouldn't even call them rare, but just a little more uncommon.
Sure.
Right?
Yeah.
What are some of those? Because I think some women are left like without answers to some of these more uncommon symptoms.
Sure. So dry eyes, dry and itchy ears.
That's right.
Those are some kind of things that you might not attribute that to a hormone fluctuation, but drying of our mucous membranes. Estrogen is really important in lubrication of our mucous membranes and our joints. It is
joint pain.
Joint pain might be another one. Like hips and knees, a lot will bother women when their estrogen is fluctuating. Heart palpitations.
Yeah, that's right.
Kind of like a beating in your chest for no reason. You're just sitting there and feel very anxious with it.
And so if you go to your conventional primary care or general care physician, they might give you an anti-anxiety medication, assuming it's stress and anxiety, but really it's your hormones fluctuating as you get closer to menopause.
Right.
And so just some hormonal support can take away those because I feel like heart palpitations are one that we actually hear a lot of women complaining of.
Sure.
And I think oftentimes it is just chalked up to stress and anxiety.
Another one would be frozen shoulder.
Yes.
A lot of menopausal women will experience frozen shoulder and think that there's an orthopedic issue when really it's just related to a decline in estrogen. And that, again, that lubrication in the joints, keeping the cartilage real supple and flexible and able to move freely. We see changes in our lipid panels.
Yes.
Or our cholesterol, eating the same diet, but now all of a sudden we have high cholesterol. What is that going on? What's going on there related to our fluctuating hormones again?
Yeah. And same with blood sugar, right?
And blood sugar regulation. Exactly.
Yeah. We actually closely follow, and our chief medical officer, Dr. Holhouse, has asked us to start keeping data on women, their hemoglobin A1C, which is an average 3 months of blood sugar, and lipid panels, and what those look like prior to optimizing women's hormones and then after. And men too, really. We shouldn't leave the guys out of that, out of this conversation in that regard.
For sure.
The before and after cardiac panels and blood sugar profiles are pretty impressive when you improve somebody's hormones. I love it.
Right.
So good.
Along with that, dry eyes and itchy ears. I was listening to another podcast earlier today that was talking about an increase in dental cavities related to the dry mouth. That she had been visiting with some dentists in her peer group or whatever. And they were saying that they will see a lot more, an increase in like menopausal women coming in with, well, I haven't had cavities for 15 years. And now all of a sudden I'm getting cavities in my mouth from the dry mucous membranes and not producing as much saliva to wash away the bacteria and stuff that are creating those cavities.
Makes so much sense.
Yeah. So kind of some fringe symptoms, things that you wouldn't really chalk up to hormone imbalances, but all
or you might not know is actually happening because you're so focused on the mood changes and the weight gain and the libido issues, right? Or the brain fog. And then until you work to optimize your hormones, then you're like, oh, wow, I didn't, it's like one of those things that you might not realize that was not optimal until you get your hormones optimal and you realize, oh, my joints feel so much better, or my mouth and eyes aren't as dry, or my skin is another one too. Kind of the creepy crawly, more wrinkles. Your skin just looks dry and like it's aging more without that potent antioxidant.
Yeah.
So good. Anything else? I mean, goodness.
Chronic UTIs.
Yes. Chronic
So many women suffer with, they call it, genitourinary syndrome, where, just painful intercourse, chronic UTIs, leaking when you cough, sneeze, or laugh, all of those kinds of things can be related to a decrease in your estrogen, which it's our hormone of vitality. It's our youthful hormone.
Yes.
What makes our skin plump and youthful, anti-aging. Yeah. It helps to prevent wrinkles, all those things.
So good. Oh goodness. Everybody just needs some hormone help. So we can see some of these perimenopausal symptoms happening in our 30s, because the average age of, or I shouldn't say average, I don't even know the statistic. Maybe you do. How long does perimenopause actually last?
I think it's very individualized for every woman out there. So many different things will impact when you start to lose hormones, environmental toxins, stress, your diet, your gut health,
liver
your
health,
activity level, your detoxification ability through your liver. All of these things will impact. So I think most of the literature says like late 30s, early 40s, you start to lose progesterone. Also quickly followed by loss of testosterone. And then you get the fluctuations of estrogen until you hit menopause. And then the estrogen stops and hopefully you're already on oral progesterone.
To help you with that dip. I know it's like we have to have the babies and we have our estradiol levels just tank overnight. And these men just get to have, it's just going to slowly come down. All right, man. We'll focus on
we
you
can
later.
handle it.
Yes. He did know he decided he wouldn't give us more than we can handle. That's so true. That's right. Okay. So, there's so many more hormones to talk about, right? We talked about 3 sex hormones, but there's other hormones that obviously play a huge role in this topic of hormonal balancing as we age. So DHEA is another sex hormone, prohormone. And then I think we also in that same area of concern, we want to talk about DHEA. Or sorry, I just meant DHEA. Cortisol. Thank you. Cortisol, our body's stress hormone. So let's talk about how those two change as we age and are related to perimenopause.
Sure. Well, as women age, they may experience higher levels of cortisol. That's, as you already mentioned, our stress hormone, especially during perimenopause due to the fluctuating estrogen and progesterone. That impacts our cortisol. Chronic stress can worsen hormone imbalances and contribute to symptoms like anxiety, insomnia, and weight gain. DHEA is a hormone produced in the adrenal glands. It's a prohormone. It's upstream from estrogen and progesterone production and helps if we have healthy levels of DHEA where our body is able to better produce estrogen and testosterone on its own as well.
Right.
So its levels generally peak in early adulthood and just gradually decline with age. So, there are in our conventional medicine world, we would be lucky if a provider would really even check a DHEA level. And in functional medicine, we look at DHEA on almost everybody.
Right. It's an easy blood test.
It's an easy blood test. It's not like
it's the specialty $500 test. It's a blood test. You check for a sulfated version of DHEA in the blood.
And it's easily replaceable through oral supplementation.
Right.
Compounded or over-the-counter versions of DHEA replacement. Conventional approach to managing low cortisol might be with corticosteroids, which has its whole host of other side effects that you don't want. And managing high cortisol, they might do with anti-anxiety medications such as Xanax or other pharmaceuticals. And an integrative approach or functional medicine approach to cortisol would include stress management techniques like meditation, yoga, deep breathing exercises, using nutrition, including adaptogenic herbs such as ashwagandha, can help control cortisol. Rhodiola and holy basil are also great adaptogens that help with stress management.
Yeah, I love all three of those. That's great.
And, optimizing our sleep, that's our body's time to rest and repair and detox. So if we're optimizing our sleep, those are other ways to help to manage our cortisol levels. And exercise is always a great way to manage stress.
Oh my goodness.
It releases all kinds of endorphins and feel-good hormones that just counteract that stress. Not just counteracting the stress, but being physically active and sweating helps to release some of the stress that we're carrying in our bodies, the tight shoulders, the headaches coming from muscle tension, all of those kinds of things. Exercise
But ladies, please
really
don't
does help.
go do 7 days of HIIT training.
Yeah.
We don't need 7 days of high intensity interval training at our stage.
Oh, just even going for a walk, a nature walk, just being out, getting sunlight on your skin and fresh air in your lungs. Deep breathing. So many times I'd catch myself walking around throughout the day and realizing I'm just shallow breathing. I'm not even breathing deep into my lungs. If I just take 30 seconds and take 3 to 5 deep breaths, filling my lungs, stress just kind of melts away with that.
That's so true.
So just being mindful can help with managing our stress. And then, as far as DHEA, we kind of talked about that already as, reference ranges are not.
I'm glad you went there. I was definitely going to mention that. Yeah.
A lab might have a reference range for DHEA that maybe it's from, I'm just throwing out a number, 150 to 200 or something.
Well,
or
I mostly see like 50 to 200.
50 to 200.
It's significant. And we're liking levels
in women like 200 to 250.
Yeah, absolutely.
For optimization. And I guess that's the difference. And we keep using the word optimization. What does that mean versus are we just mitigating symptoms or are we optimizing you to really feel your best where we know your body has all the tools it needs to help you feel your best?
Yeah. And it's so much bigger than even feeling your best, right? You already mentioned all the preventative benefits we see, right? With, brain, bone and cardiovascular benefits with these hormones. So yes, it's feeling your best the here and now, but what's your life going to look like when you're 60, 65, 70, and you have that family history of cardiovascular disease or Alzheimer's dementia that can be, scary as we all start to raise children and, feel our aging bodies. And we want to be preventing some of these very preventable conditions and diseases as well.
Right.
So yeah. Well, I feel like you hit it pretty hard. I know you and I both get this question a lot, non-hormonal treatment options for some of these hormones, right? You mentioned the exercise, the sleep, stress management is huge. I can't help but think, women in their late 30s to early to mid 40s, it also happens to be a time that you're in the thick of raising children, the thick of working.
Your career.
Trying to take off with multiple things. Or even just the stress of, I'll speak for myself, you start to see that your kids, it goes so fast, and you want to really take advantage of that time and just the added stressor of, just raising children, trying to keep your marriage, at an A- B+ at best, right? It's just, you're juggling so many things. And so it's so easy to tell us as women, like, manage your stress. It's like, great. Tell me how to do that.
It's stressful hearing that.
It is really stressful hearing that. But I love how you gave the tips of, like deep breathing, going for a walk, doing, even if it's 5 to 10 minutes a day of self-care.
Right.
I think for women too, at our stage of life, being okay saying no,
right.
And just really learning who you are and what your priorities are and how you're spending your time and who you're spending your time with. I think there's just a lot of
important point
power that comes out of, like knowing internally who you are and the security of just what you're doing with your life. And, I don't know, I think that can mean a lot of different things to a lot of different people, but it can be really freeing when you kind of learn that and know how to focus your time and your energy and your thoughts.
Absolutely.
Yeah.
So if you were asking some more practical, ways to non-hormonal ways to support your natural hormone production, stress management.
Yeah.
Supporting liver detox.
Love it.
So ensuring that you're getting 30 to 50 grams of fiber in your diet daily. Daily bowel movements, so important. Hydration with electrolytes, not just plain water, but electrolytes so that you're absorbing the water into your cells.
Yeah.
And alcohol.
Ugh,
alcohol is not doing you any favors. It's harming your gut. It's hurting the bacteria. It's
hard on your liver.
It's hard on your liver. It's
just destroys your sleep.
Yeah. Destroys your sleep.
Yeah. I do feel like alcohol is actually getting, it's interesting now, and we don't eat out a lot, but the couple, I don't know, once a month or once every 2 months, we do eat out. I notice on all the menus, there's now mocktail options. Like it's now cool to have an alcohol-free drink. And I love that.
There's new social media terms like sober curious or...
Are there?
Yes.
Oh, I love it.
So I think the pendulum is starting to swing. People are realizing that alcohol, there's really no health benefit to alcohol.
There really isn't.
It's become socially acceptable and even in some cases socially expected that people would have a drink if they're out to dinner. But it seems like there's a movement out there. People are kind of starting to value their health a little bit more and thinking, why am I putting this in my body?
Yeah. And we all need to be thinking
it's a great
about
movement. I like it. Balancing blood sugar can help that's another non-hormonal way to support your natural hormone production. So focusing on protein, getting a gram of protein for every pound of lean body weight that daily, focusing on healthy fats, avocados, nuts and seeds, and fatty fish.
Yep.
And then reducing refined carbohydrates. We don't need added sugar in our diet. And that added sugar just feeds bad bacteria in our gut and adds to what we call gut dysbiosis, which is an imbalance in good versus helpful bacteria that live in our gut.
And that concept of just, the gut microbiome and dysbiosis is also really important in your metabolism. So even aside from your hormonal imbalances, I don't think enough people pay attention to gut health when they're trying to lose weight,
right?
And evaluating that aspect of their body when it comes to a healthy metabolism. So gut health is so important.
And even thinking about reducing exposure to environmental toxins. We live in such a toxic world.
Yeah.
From the food, the air, the water. I don't want to sound like a Debbie Downer on this, but just looking at things to clean up your skincare, go on the apps that are out there, the Environmental Working Group, Ruka, I think is another app. There's so many apps out there that can just help you. You could just scan your products and find out it's rated like a scale of 1 to 10 or green, yellow, red type thing on what is a clean and healthy product to be putting on your skin rather than something full of chemicals that your body doesn't recognize. Your liver has to try to process and remove, and even non-toxic, like household cleaners and stuff like that.
I was going to say, ladies, this is so much more than just like your shampoo, your lotion, and your makeup.
Yeah.
This is also
that you use,
the cleaners, the candles,
laundry detergent, candles. Yeah. Good point. Air fresheners, perfumes, all of these things.
Yeah.
Our body has to process.
Yeah.
And then, and water, don't drink tap water, invest in a water filter. Yeah. Helps to filter out, heavy metals and
environmental toxins, pesticide. Yeah. Our city water here in the Treasure Valley is not ideal. I'm not sure there's a lot of city waters that are actually ideal though.
And then lastly, I would say, nutrient deficiencies, really, working with a functional practitioner or somebody who's going to look at your nutritional status and see, are you a little low on zinc? How's your magnesium? I can guarantee it's low because we all are low in magnesium. And 100%. Magnesium is so important in stress management. So if stress or anxiety and depression, all these things are part of low hormones, and we're not supporting with simple things like magnesium, well, there's some low-hanging fruit that we have to look at and deal with.
And kind of like we were talking back to the DHEA, these are simple blood tests.
Yes.
That should not cost an arm and a leg. And every provider should know how to order these simple. And if you are talking to a provider and trying to get these labs ordered, the red blood cell level, RBC, is the most accurate one because you can look at like a serum magnesium, but your RBC levels are actually going to be a little more, what's in your cell. That's going to be a little bit more accurate when you're looking at that. So just helpful hint if you are trying to work with a practitioner and inquiring about these lab tests to get. So good. You just gave so many good tidbits that people can apply at home.
Yeah.
Okay, now getting into the nitty gritty. When is it not enough to just use sleep and stress management and a healthy diet to really optimize those levels, right? We mentioned it with DHEA. We're looking, we have our own kind of optimal ranges we see. We kind of think some of the reference ranges out there for hormones are bogus, but when is that not enough? And who is a good, I guess I'm also asking who is a good candidate for getting some of these hormone levels optimal? And by that, I guess we're talking about bioidentical hormone replacement, because this is a whole can of worms we can open on some of the myths behind, bioidentical versus synthetic HRT.
Yeah. Yeah, for sure. Well,
I feel like
you just asked me like maybe 3 questions in there. So
4 questions.
Where do we start?
Break it down however you want, girlfriend.
You asked about when is diet and lifestyle changes not enough?
Not enough. Let's start there. Yeah, I like that.
So diet and lifestyle can be complementary to hormone replacement therapy. But we know that as women hit menopause, the ovaries really do stop functioning, and there's no amount of diet and lifestyle changes that we can do to bring those back or to replace the hormones that our bodies once were capable of making on their own. So, we can focus on exercise, sleep, eating clean protein, healthy fats, decreasing dietary sugar, and ensuring healthy levels of micronutrients. But in addition to that, hormone replacement therapy is an option. It's not right for everybody.
Right.
They have to make a decision, an educated and well-informed decision about it. But bioidentical hormone replacement therapy has been shown in many studies and proven to help to reduce osteoporosis, improve cardiovascular health, and reduce your risk of Alzheimer's dementia. So beyond even just the hot flashes, night sweats, anxiety, depression, there are real health benefits to having optimized hormone levels.
Yeah. And so who might not be a good candidate for bioidentical hormone replacement therapy?
So yes, hormone replacement therapy does have some risks that come along with it. I would say your main risk would be working with someone who is not educated in hormone replacement therapy.
That's a great response.
We can really mess people up if we don't know what we're doing.
Yeah.
And it's not enough. There's research that shows estrogen replacement therapy is being done out in the conventional medicine world, but always the lowest dose for the shortest amount of time, just enough to decrease hot flashes and night sweats. But we know in the research, it shows that if we can get your estrogen level greater than 50, and ideally between 60 and 80, is where we see all the cardiovascular, brain, and bone benefits. So it's not enough just to stop the hot flashes and night sweats. We've got to go a little bit further.
We're actually looking for those optimal values.
Exactly.
Yeah. So it's also, and that also makes me think in making sure you're working with someone that knows what they're doing. Are they checking your levels before and after and making sure those levels are getting in the optimal range and not too high? Right. Because when you have too much unopposed estrogen, that's where you can, and by unopposed, I guess we should kind of define what that means, right? What's unopposed estrogen in the body? Yeah.
So estrogen needs to be complemented with progesterone.
Right.
If estrogen is our hormone of growth, it's proliferation. It grows the lining of our uterus, and progesterone counteracts that. And it's like the accelerator and the brake pedal.
Yeah.
And so if they are out of balance, you're either going to have a whole lot of growth and not enough suppression, or so much suppression, not enough growth, so that you're not really achieving the optimal benefits of having the hormone replacement. So it's really a delicate balance between the two.
Love it.
To make sure that we're doing all good and no harm.
Yeah. So of course we're treating the patient in front of us, but we also need to look at what are your lab values telling us? Right.
And when you talk about other risks of hormone replacement therapy, so there's many different routes of administration that we can talk about. Specifically, oral estrogen I've seen used out in the conventional medicine world, and that is one that carries the most risk with it. It has to go through our liver, and it increases our risk for blood clots, and which can lead to deep vein thromboses or stroke or heart attacks. So oral estrogen is kind of not the best route
and
of
it's
delivery.
pretty controversial because a lot of people will say it gives you the most benefit to cardiovascular. To your cardiovascular symptom without some of the risks. And there's some of the literature that doesn't fully support that.
Right.
Yeah.
But we do know that transdermal administration, pellets or patches, provide the benefits of hormone replacement therapy for estrogen with very low side effects of it. So risk, someone, if they had a history of a clotting disorder or they have risk of cardiovascular disease, they have a family history, or maybe they've already had a heart attack in their past, they would not be a candidate for estrogen replacement therapy. But that doesn't stop them from being able to receive progesterone.
Right.
Progesterone is our calming hormone, very helpful in helping with sleep, and it's actually breast cancer preventative.
Yeah, yes, it is.
We have hormone receptors in every tissue of our body, brain, heart, gut, skin, everywhere. And so, I've even heard stories of conventional medicine saying, oh, you don't have a uterus for a woman who's had a hysterectomy. You don't have a uterus. You don't need progesterone. Yeah. There couldn't be anything further from the truth than that. In fact, it's breast cancer protective. So yes, even if you don't have a uterus, you want to be on oral micronized progesterone.
Yeah, I would agree. And what's the difference between, well, in this case, let's talk about progesterone, right? I mean, there's a lot of different kinds of progesterone we can be putting in our body, right? Cream versus oral. There's synthetic progestins that have no similarity to our bioidentical progesterone. So that's the kind of progesterone that's actually in birth control. And a lot of our young women aren't fully educated on the risks of these synthetic progestins. It's just not the same as what our body makes and what our body can respond to.
Yeah, it doesn't have the protective benefits as a true progesterone, which is the same hormone as our body makes. Progestin is a synthetic version of it. And think about it, if with these synthetic hormones, it's kind of like the key fits in the lock, but you can't turn it. Yeah. So the synthetic progestin fits in the lock in the hormone receptor, but it doesn't turn the key. It's not doing anything. It's not providing the hormone benefit in your body.
Yeah. Well, and I think the other important thing to know also is that, yes, you're spot on with the progestins, but also if your body's getting it from a synthetic source, it's not going to be making as much endogenous. So these 25-year-old women that are on birth control and have been since they were 15 years old, I mean, goodness gracious, I don't even want to know how they're going to feel when they're 35, 36, 37 years old after 13 years of birth control. After getting the synthetic version, then you really get depleted and it's so much harder for your body to make these endogenous chemicals. So yeah, I think that's a really important message to get out there.
Right.
Yeah, it's so important. Are you looking for high-quality supplements? FunMedShop.com is carefully curated by the wellness experts at Functional Medicine of Idaho. You'll find high-quality supplements to support your health and optimize your body's natural functions. Rooted in responsible sourcing and utmost commitment to purity ensures that you're getting products that are not only effective, but also safe and reliable. Plus, you'll find our own line, Functional Medicine Foundations, which is carefully formulated using the best ingredients available so you can trust that you're giving the body the support it needs. Visit FunMedShop.com today and take the next step in your health journey. That's funmedshop.com. Wonderful. Yeah. So back to bioidentical hormone replacement therapy and what we're really trying to do here. How do we see HRT impacting mood, libido, just overall well-being and how we just feel and function as women?
Sure. So estrogen, back to our three main sex hormones again. Estrogen replacement therapy can improve vaginal lubrication, elasticity, blood flow. It helps to support serotonin and dopamine levels, which leads to reducing depression, anxiety. Also helps with memory and focus. It also improves bone density and cardiovascular function, reducing the risk of osteoporosis and cardiovascular disease. We've hit on those topics already.
Yeah, definitely.
Progesterone promotes relaxation and reduces stress-related libido suppression. Oral progesterone acts on the GABA receptors in the brain, which helps with relaxation and deep sleep quality. So oral micronized progesterone taken about an hour, 30 minutes to an hour before bed helps you to get into that deep sleep, where that real, that like REM sleep, where you're just getting real deep, restorative sleep, and can help us stay asleep longer. And then testosterone plays a crucial role in sexual desire, arousal, helps boost motivation, confidence, and mental clarity. It's kind of our like get up and go hormone.
Yeah.
Like I can take on this day.
And it helps with sleep too, right? The brain, calming the brain down and helping with that deep sleep.
Very active in the brain too.
Very similar to progesterone. Yeah.
And then estrogen and testosterone together, they both improve our mitochondrial function.
Yes.
And muscle mass, leading to better endurance and strength.
I love it. So back to the mitochondrial function. So that's one that can really help energy.
Sure.
Right? So your patient's coming to you with just low energy in general. Hormone.
Yeah. Is it low energy from not getting good sleep, or is it low energy from having deficient testosterone?
This is another one to go off the topic of our sex hormones a little into other hormones, thyroid. Because I feel like there's so many conversations around our hormones, and women just assume that it's your sex hormones you're talking about. But, we've talked about cortisol, and there's other, adiponectin and leptin that are also important for metabolism, but that veers a little bit too much off topic. Thyroid. So you and I have talked so much about this poor T4 to T3 conversion that everybody has, right? So when we're talking about that, TSH gets produced from the pituitary gland in the brain, and it acts on the thyroid gland to make T4. T4 has to get converted into T3. And I see women come to me with labs, and they have not had a T3 or a reverse T3 checked on their thyroid lab panels, or they have also not had thyroid antibodies checked. And I read some statistic the other day that 85 to 90% of hypothyroidism, weight gain, brain fog, cold intolerance, muscle aches and pains, constipation, fatigue is due to this autoimmune thyroid disease, otherwise known as Hashimoto's, right? So women, if you are gaining weight, you are not feeling your best, you're depressed, you're achy all the time, absolutely look at your sex hormones, but make sure someone is also checking thyroid function.
Absolutely.
Which includes a full panel with thyroid antibodies to see if your body is attacking self. We need a whole nother podcast on Hashimoto's and hypothyroidism.
On thyroid, yeah.
But back to the T4 to T3 conversion, and what Heather and I mean is that your T4 levels actually look pretty good. Again, we're looking for optimal ranges here, but your T3's in the tank. And we know there's lots of different things we need to convert adequately. What's the sex hormone we need to convert adequately?
The progesterone.
Progesterone. Oh my goodness. We learned this, and it was like this aha moment for Heather and I to say, oh goodness, yes, we know toxins, we know stress can all inhibit that production, but women need progesterone to convert our thyroid hormones appropriately. So a lot of it does come back to that hormone imbalance is truly being root cause, right? I still think there's a lot of this talk of you can fix your hormones naturally, eat well, sleep, and it'll get you optimal. But no, really, truly, we're seeing that these perimenopause, postmenopause hormonal imbalances can truly be root cause of some of these diseases and conditions that we're seeing. So yeah, it's so important. Sorry, I veered a little bit off course, but I've just been so passionate about that because progesterone is so important for so many different reasons. Our well-being, our thyroid health, sleep. If we could just fix some of these women's sleep, it would just take them so far.
Sure.
Right? Okay, so I digress. Now I'm regressing back onto the topic. Other misconceptions about bioidentical HRT. I know you've touched on a lot of them, but I want to make sure we hit them all just to kind of bust some of the myths out there.
Yeah, I mean, it's unfortunate, but it goes back to 2002 with the Women's Health Initiative study that came out saying that hormone replacement therapy causes breast cancer and cardiovascular disease. And unfortunately, in that study, they were using synthetic hormones. They were using Primpro, which is synthetic estrogen, synthetic progesterone. And I mean, the outcome of their study was not good, but it's we're also not using those hormones in our patients.
Right.
And so we're not comparing to apples there. And so unfortunately, here we are 23 years later, still dealing with the same negative outcomes of that study that was just poorly done. And we're doing our best to try to educate and reverse that that thought process in people, but it still seems to be so common in our conventional medicine world. And I'm not trying to throw shade at the conventional medicine world.
Right.
There's not a lot taught about hormones in med school or NP school.
Really good point.
I was reading something, they get about 2 hours of education on hormones as OBGYNs on hormone replacement therapy. And I was reading a statistic that some 75% of residents coming out of med school do not feel comfortable talking to women about menopause or how to deal with that transition in life. What a disservice we're doing to women.
It is, isn't it? Well, and so many women will say, well, my doc wouldn't check my levels of hormones. And I'm like, well, yeah, we're not going to check labs if we don't know what to do with them. Right. So some of these practitioners that aren't educated, if I wasn't educated on hormones, I wouldn't feel comfortable ordering all of these sex hormones on a client if I didn't know what to do with those labs, right? Then I'm responsible for interpreting those labs and knowing how to apply them to what's going on with your body. So yeah, no, you're right. It is such a disservice to women.
So super important that you're working with a provider who has gone the extra step to educate themselves or to be knowledgeable about hormone replacement, about menopause, that they can, so that they're safe in replacing your hormones, and they're using the right delivery method.
Absolutely.
To replace your hormones.
Pellets. Tell us a little bit about pellets for women.
Yeah, pellets. So we can do estrogen or testosterone pellets. We work with a company called Evexapel that makes our compounds our pellets with ethyl cellulose combined into them, so that there's a delayed release over time. You're not getting a huge spike and then a big drop off in your hormone levels. It's kind of a gradual three week climb up, more of a plateau out, and then a gradual decline off, where you would come in and get another pellet placed. And for women, it's about every 3 to 4 months that you would get your hormone pellets replaced. It's a really nice and convenient delivery option. You're not having to think about giving yourself an injection or applying a patch or applying cream every day. It's, it's a minor procedure. It takes about 15 minutes in the office, and it's every 3 to 4 months. So I love pellets. It's my favorite hormone delivery method.
Yeah. Wonderful. Yeah. So pelleting estradiol and testosterone. You still want to take the oral progesterone in most cases.
Yes.
For the endometrial protective benefits and just those brain protective benefits we get from progesterone.
Yeah. And then some of the other misconceptions about HRT that need to be addressed is, the HRT is only for severe menopausal symptoms.
Agreed.
Well, why? Yeah. Why does it have to be only for severe stuff? Like, why can't we, why can't we all just feel our best?
Yeah.
If there's very low risk and nothing but benefits to gain from it, why wouldn't we replace our hormones if we're the right candidate for it? Another misconception is that HRT is dangerous for the heart or causes weight gain. Estrogen actually helps to maintain healthy metabolism and is protective on the cardiovascular system. Only women in their 50s can use HRT. Yeah. Well, no, we can actually start with progesterone and testosterone replacement in our late 30s, early 40s.
How would you advise a woman that's maybe 65, 70, new diagnosis of osteoporosis, reading about the benefits of HRT? How would you advise a woman who's, 10 years post-menopause and considering the use of hormones for concerning signs of dementia or cognitive decline?
Sure. Well, there is no recommended age to start or stop hormone replacement therapy. Let's just get that out there. It doesn't matter if you're premenopausal or 10 years postmenopausal. You can start hormone replacement therapy at any point in time and you will still receive benefits from it. So someone looking at maybe they've gone for a DEXA bone scan and they've been told they're osteopenic, or maybe they've advanced far enough to the point where they're actually osteoporotic. Testosterone and estrogen could be great,
so beneficial for the
supplements to help with that, with helping the bone restructuring. Also ensuring that you're getting plenty of collagen in your diet and vitamin D with K2. other micronutrients.
Weightlifting, build that muscle, which protects your bones.
Exercise, exactly.
Yeah, so many different things we can do.
So many different things that we can do rather than using another pharmaceutical.
Mm-hmm. I love it. So what advice would you give to women that are just concerned and, concerned about, I guess, just replacing their hormones because they want to try and do it naturally? What's your advice to a woman who says, I just really want to go through this change naturally?
My advice would be to educate yourself.
Okay.
To work with someone who can provide quality education for you, peer-reviewed studies, not just social media posts or,
good point.
I heard my friend kind of had this experience, so I don't ever want to do it. Don't go down that road, ladies. Like really work with someone who knows what they're doing. And we spend 40% of our lives postmenopausal. That's a big portion of our lives to not feel our best or to be playing with fire a little bit, if you will, like our risk of cardiovascular disease and Alzheimer's dementia goes up if we don't have our hormones optimized. So, I mean, it's not going to be right for everybody, but at least make an educated decision for yourself.
Yeah. Or go see someone. I love that advice. Go see someone who knows what they're doing and who's educated in it.
Yeah. And don't suffer in silence.
Yeah, absolutely.
Talk to your provider about the symptoms that you're experiencing. Not every woman will have the exact same symptoms of perimenopause or menopause.
Yeah.
Some women may have bone and joint aches and pains. Some women might have more of the hot flashes and night sweats. Everybody's a little different.
Yeah. Other women might just be gaining weight.
Exactly.
Or might just be really irritable.
They're just grumpy by nature.
So stop just allowing your husband to give you a hard time. Get those hormones checked, right?
That's right.
Because it might just not be your fault. It's your dang hormones.
Yeah. And you might open up a whole new chapter to your life that you are so excited to be in.
Yeah. That's so true. Yeah. Ladies, we hope you can share this episode and just these tidbits of information with friends and families and mothers and sisters and daughters, because I agree. No one should have to suffer in silence. And we can't overemphasize the importance of, feeling your best and, bringing your best home to your spouse and your family and your children, right? And being able to show up for your loved ones. But also the preventative benefits we see, because we are not a very healthy country. And we'd love to be able to see statistically some of these, like even just cardiovascular disease, some of those statistics improve. So it'd be wonderful to see. Thank you. You are such a wealth of knowledge, and we are so blessed and honored to have you here. Heather is accepting new patients, and she is rocking and rolling, doing all things pellets and hormone optimization and thyroid health. And so, if you're interested in learning more about Heather, please go to our website and check out her bio. Thank you for joining us.
Thank you.
Thank you for listening to the Functional Medicine Foundation's podcast. For more information on topics covered today, specialties available at the FMI Center for Optimal Health, and the highest quality of supplements and more, go to funmedfoundations.com.